This is my favorite thing to show patients. It's a masterpiece, I know. This is how movement happens. The first part of physical therapy is we loosen the tight stuff and we strengthen the weak stuff. This is strengthening the weak stuff. So we have a brain, we have nerves that run through a spinal cord, and we have muscle. Ordinarily, normal, healthy, this all works. Brain says, hey, bend our elbow. Nerves say, okay, we'll go talk to the elbow muscle. Elbow muscle says, yep, we're strong enough and healthy. We can do that. Elbow bends. That's oversimplifying a beautifully complicated, artful, miraculous process. Okay, but that's kind of how it works. Brain talks to spinal cord, talks to muscles. Usually in physical therapy, people come in here and there's something going on here. Now, someone's had a stroke, someone's had a traumatic brain injury, there's a problem with movement that starts up here. Someone gets in a car accident, someone dives into a pool and breaks their neck type of thing. We usually have a problem in the spinal cord. Most of the time when people come in here for physical therapy, their muscles are angry with them, right? There's inflammation in a muscle or a tendon or a tear somewhere. And this part of this piece of this puzzle is the thing that's out of whack. So you look, and I drew these tiny little, these are called neurotransmitters. Okay, there's one called acetylcholine that is responsible for getting your muscles to contract. Okay, and they're just molecules of it's just chemistry. So usually what happens is, well, we just talked about this, brain talks to spinal cord, talks to muscle. If there's inflammation in here, if there's a signal that like, hey, we don't want to do that, if there's a tear in this muscle, this all can work just fine, right? And the signal can get sent, but the muscle says, well, there's nothing to pull here. We've torn something, right? Torn a hamstring, torn a rotator cuff. There's nothing to pull. You can try to move it all you want. It just, there's no pulley there to move the lever, okay? If there's a problem in the muscle. But if there's not, if there's just inflammation in there, what basically happens is these little neurotransmitters, they're supposed to talk at a normal talking volume, okay? When there's inflammation in there, that volume kind of drops to a whisper. Okay, so if the muscle is healthy, but there's inflammation in there, right? Let's reconnect our muscle. If there's inflammation in there, if there's a reason that that muscle says, we don't really want to, there's something dangerous happening down here, we don't want to fully contract. Okay, we have to, number one, figure out the diagnosis. What is your muscle perceiving to be dangerous? And can we start to rehabilitate it? Did it start to heal at all? And second, has it affected the recruitment of that muscle? Okay. The first step in physical therapy, when someone comes in with a musculoskeletal problem, is to re-educate this part right here. So let's zoom in on this, right? A nerve ending looks more like that, and a muscle looks more like, well, muscle has receptors on it, okay? And what happens is these little neurotransmitters are inside of the nerve, and then when they get the signal to contract the muscle, they leave the nerve through these little channels, and they go into this space, okay? And if the muscle perceives that neurotransmitter, the muscle then binds that neurotransmitter, and you get a muscle contraction, right? This big long chain has to happen. Again, it's beautiful, it's artful, it's miraculous. Once the muscle has started to heal, and once there's no reason for it to perceive a threat, we have to start adding more neurotransmitters to this space. Okay? And the way we do that, we call it neuro re-education. We have to re-educate this nerve and this muscle to start working together like a team. We have to take it from a whisper and ultimately get it back to talking and then turn it into a shout. Okay, we turn it into a shout by adding tons more neurotransmitters, and then your muscles adapt and your muscles create more receptors. Okay, it's amazing. Okay, that's called a motor unit if you want to Google that and learn more about it. So that's how physical therapy works. This happens pretty quick. This happens within, this can happen within a day. Usually it takes about 2 weeks for this to improve. Once that's improved, then we start adding fibers to the muscle. Then we start getting more contractile tissue, which makes our muscles bigger and stronger. But we can't get more contractile tissue until we've given our body the signal, hey, we need more of this stuff before we can make more of this stuff. Okay? So that's how movement happens. That's the first step in this rehab process. I often tell people, you're going to feel better in like 2 weeks. You're going to feel like this is stronger. in 10 days, 10 to 14 days. To actually get it stronger, you got to stick around because this process takes 4 to 6 to 8 weeks to really get a muscle stronger. And it takes the right dosage and the right loading to do it. Okay, we call that the Goldilocks effect. I'll talk about that in another video. Okay, but this is how movement happens, and it's brilliant. And I just oversimplified a really complicated, miraculous process, but that is how I explain it to patients to get them to buy into the things that we're doing. Okay, if you have any questions, let me know. Keep moving.